Well, welcome everybody to week 4 of our July program on drug prevention programs. Now, so we've been talking about these drug prevention programs, what doesn't work with them, and last week we talked about what the modern researchers, their new tactic of asking the young people what are the positive experiences that they get out of drugs, what are the rewards, what are the benefits, as part of this new approach. And a lot of the researchers now are getting this idea now, we have to take these ideas we've been finding and put them into drug prevention programs. So rather than just say, well, drugs are bad, don't do drugs, now we have to address what the young people find is beneficial about them. And one of the researchers actually pointed out the obvious when you think about it, is that one of the reasons why young people are resistant to drug prevention programs, why these drug prevention programs don't work, is precisely because they personally believe there are benefits to using drugs. And if you believe that this is a beneficial behavior, then chances are you're not going to be paying much attention to people who are telling you drugs are bad, don't do drugs. So the idea is if we could incorporate some of these these benefits or address why young people think it's beneficial to do drugs, that we'll have much more success in our drug prevention programs. Unfortunately, I don't think anyone's actually developed one of these programs yet. So that's kind of interesting too. Although there's a new program at the University of Victoria at the Centre for Addiction Research in BC, which they're piloting at the moment. I believe they have the grade 10 curriculum done and maybe one other, but it's in a very early stages, and I don't think the research has been completed on the focus groups and all these other kinds of things you have to do to see how well it's working. Anyway, but some people at least are doing a little more cutting edge work in the drug prevention field. But if you could address these benefits, then maybe we'd have a little more success. And you may remember from last week, we talked about two of the big benefits. One is this idea of, from the dance clubs, the electronic dance clubs, is that when you do ecstasy, for example, you feel this communal feeling, right? So I'm close to people. We care for each other, everything's good, we feel like this close group. And then this other idea that when you do ecstasy, then you get this feeling that you're transcending your normal, kind of boring, ordinary life. Well, they've done studies out of the United States, actually, on this cough syrup that gets you high. DXM, the short form for it. And a lot of the one researcher I'm thinking of particularly, he's talking about we should do a lot more studies on this. And the reason is that if you go to the internet and you read a lot of websites, one of the more famous ones is Arrowhead, and you read what the people are saying when they're using this cough medication, then you get the sense that this is a way of transforming yourself, of transcending yourself, what the psychologists call getting a transpersonal experience, which is an experience that sort of the world is bigger than you are, and also space and time sort of lose their meaning, or just in short form, this feeling of transcendence. And then other people have studied different kinds of drugs, cannabis they've studied, and so there's this modern cutting edge research into exploring these positive benefits in the theory that if you could address them, this feeling of transcendence, if you could address this feeling of social cohesion, you would have much more success in preventing people from using drugs. But you can think about this even in your own recovery, is that maybe these elements, feeling a sense of belonging with people, attaching your life to something bigger than you are, maybe are fairly important to your recovery. And if you think even of the 12-step program, I mean, that's exactly what it's all about, right? This forming this community where you have a sense of belonging, the AA group, even in step 12, right? To go out of your way to help another fellow suffering addict. And this feeling of transcendence, right? Step 2 and 3 and step 11 is this concept of attaching your life to something bigger than you are. So Bill Wilson, even he understood this whole concept. In fact, if you think about Bill Wilson's interpretation of alcoholism, you can understand why these young people are saying there are benefits. Because you've got to remember, right, back in 1943 at the Shrine Auditorium in LA, Bill Wilson talked about the alcoholic as the fellow who's trying to get his religion out of a bottle when what he really wants is unity within himself and unity with God, right? So that's pretty cool benefits if you can get that. Of course, it all backfires, so it never worked. But that was Bill Wilson said the urge to use alcohol was the urge to attain this connection with yourself and a connection with something bigger than you are. And interesting enough, and again, when we talk to the young people about the benefits they perceive in doing drugs, we hear these same things being talked about. Right? So that's actually kind of an important clue, I think, to the nature of addiction and what you might have to do in recovery. And how are you going to get this connection with other people? And how are you going to break out of your own little self-centered world and connect with something bigger than you are? Right? So that's kind of interesting. And I think perhaps, too, that this is a clue about why our current fare of drug prevention programs don't really work, because they all have the basic theme, drugs are bad, don't do drugs. And yet, without looking at all at what the young drug users actually think of it as a benefit, a positive experience of intoxication. But anyway, stuff to think about, and that's our program for this week, and we'll be back next month with another theme.